Welcome back. Today we're talking with an old friend of mine, Bindu Mane. You know, Bindu also used to be an advisory board member for the Eye Foundation of America, which helped prevent childhood avoidable blindness in places like India and Ghana. So Bindu definitely knows what she's talking about. Let's welcome her to the program to discuss avoidable blindness once again. Bindu, welcome to the program.
Thank you, Matt. Great to be here, and I really appreciate the invite, and it's really awesome to see your face.
Well, thanks so much. You know, what do you think about this possibility of avoiding blindness worldwide and how that might be done in the future?
Yeah, so, I've been, like you said, in eye care for 16 years, and I would say avoidable blindness is not a phrase we routinely use in the U.S. We do have underserved, pockets and communities, but generally speaking, we have, as you know, tremendous access to care, and we have a high supply of physicians and well-trained physicians in the U.S. and versus the developing countries. And I became aware and grew to appreciate the phrase avoidable blindness through some of the work I did as advisor at SightLife, which looks to eliminate corneal blindness, as well as Eye Foundation of America, which was started by Dr. V.K. Raju, who's an ophthalmologist in West Virginia. And this organization is focused on treating avoidable blindness, especially childhood blindness, such as ROP, or visual impairments in remote parts of India and Africa, where access, as you know, is limited and costs could be prohibitive. When you think of, 33 million people with avoidable blindness and 227 million with avoidable visual impairment, and 80% of that is preventable or treatable. And the economic, the societal, the social impact is huge. And so you learn of these patient stories who come through these organizations with, it could be something simple as nutritional etiology, vitamin A deficiency, or unaddressed, uncorrected refractive errors such as myopia, presbyopia, and a simple pair of glasses. I mean, think about that. Simple pair of glasses can restore that person's livelihood. Is something that I don't think we think of that in a developing country. So when I think of avoidable blindness, it's almost like a lottery of birth. In a developing world, the odds are really stacked against you. And I was born in India. I was fortunate to have my parents uproot us from India to bring us to America, where the opportunities are limitless. And so I have views as to, how healthcare or how access could be limited in a country like India or a developing country versus where I'm fortunate to live now.
You talked a little bit about problems in the U.S. before as it concerns eye care. So do you think blindness can be avoided both in the developed and the developing world?
90% of blindness in the world is in the developing world, but it's, like I said, 80% is treatable. When you think about the highest need for avoidable blindness, which is refractive, uncorrected, unaddressed refractive error and cataracts, and then glaucoma, these are there are easy solutions for these problems, and early intervention can have a huge impact on society. Also, the easy answer is yes. I think it can be avoided in developing world or developed world as well.
It was interesting. I recently read a book on this group, both Aravind and Arlab. They have an amazing story how they rose up from essentially an 11 hospital bed unit to become one of the largest, if not the largest, provider of eye care in the world through their hospital system. And one of the points that they've kind of followed along the way is training the competition. Meaning, once they developed a system that they knew worked, they would kind of almost in a wiki-like way share that with the competition around India to also enact that. And I think that that's possible and interesting for our industry, because I know many times we've come together at forums like OWL, and you would have executives there sitting from Bausch & Lomb and Zeiss and Alcon, for example, kind of collaborating in that particular environment. So it does seem like in our industry, there is this spirit of maybe, competition, but also collaboration. And if that's so, then do you think that that spirit is able to take us forward to tackle some of these problems?
Absolutely. That's a really great example. You have a successful organization, institution like Aravind, who train physicians outside of their institution. So that means that in remote parts of the country, patients are able to have access to care. I mean, that is certainly how make changes and you address a large population is through collaboration, and certainly who can train other physicians. Skills transfer is extremely important to address that.
Because I remember last year interviewing a Somali doctor surrounding WOC. He was saying that there really isn't any retina laser in the entire city of Mogadishu, and it might have been the entire country, which was surprising. That kind of hit home to me, because after all these years thinking about Africa in terms of being a continent in need, but it kind of brought it right back to the industry. What are we doing as a community in a continent like that? And so eventually, maybe it will be companies that can somehow use the innovations that we find in places like America, but really be able to provide access to those continents like Africa. I think that seems like it would be key. And how that access happens, when, it's anybody's guess.
I think countries, companies in developing world have an obligation to pass that along to whether it's to donate technology to developing parts of the world. I think health equity is a huge target in the U.S. Our payers are holding us accountable for what we're doing to make health equitable, and I think we need to look at that, take that approach internationally as well when we're developing technology, to make sure that we're finding avenues, path to provide access to developing world.
That's a great subject too, because certainly the phrase social justice has come home to ophthalmology. Groups like OWL have been at the forefront of ensuring that our industry rises to support a diverse community within ophthalmology. But it certainly seems like, since we are a global community, we're not just siloed into different countries, there is opportunity to discuss social justice within our industry worldwide. What do you think about that?
I think it takes organizations like you, and I think like Orbis, and for people like you to raise awareness. And you're certainly a global person. You have relationships with physicians and networks across the world. And we need people like you to call that out and bring that community together, I think.
Well, Bindu, thank you so much for this lovely interview today. You certainly shined in answering all these questions, and we thank you so much for joining us.
Thank you, Matt, and congratulations on your role as ambassador for Orbis. And the amount of the work that they do is tremendous and remarkable. And we need Orbis to thrive. And I can't think of a better ambassador to raise awareness with the global network that you have. And we can't wait to see you back in person in the U.S.
Thanks, Bindu. See you soon enough.